Hello everyone, my name is Daniela Salles and I'm here to talk about hemophilia. Hemophilia is a genetic rare bleeding disorder which blood does not clot properly. It's congenital, which means the condition may be hereditary. So even if a woman inherits the gene for hemophilia, they are only considered carriers, which means she can pass the gene to her children. It is divided in two types, hemophilia A, resulting in abnormal bleeding, and hemophilia B, which also causes the person to bleed longer than others. However, recent studies suggest that individuals with hemophilia B may experience less severe bleeding than those with hemophilia A. Some major characteristics for hemophilia are impaired blood clotting, resulting in the blood not clotting normally, making it difficult to stop bleeding from injuries, surgeries, or even minor cuts. So you see here in the figure 2, we have a healthy blood vessel and the one with hemophilia. So in the healthy one, when there is hemorrhage or when there's a cut and you start bleeding, your body starts working on the coagulation, so the clotting, so that will stop the blood. On the hemophilia vessel, what happens is once there is the cut, there is the hemorrhage. What happens is the blood, the body is unable to clot, so there is no coagulation, and the person continues to bleed. There is bleeding to joints and muscles, which can cause pain, excessive swelling, and long-term damage if not treated. There's excessive bruising. In this case, is when individuals may bruise very easily and often have large unexplained bruises. There's prolonged bleeding, which is when bleeding after minor injury, surgery, or even dental work can last much longer than would for someone without the disorder. And we have spontaneous bleeding, which may occur in the absence of any obvious injury. As prior noted, hemophilia is characterized by excessive bleeding. This bleeding can lead to severe arthropathy, which is a significant degree of joint degeneration, leading to severe pain, stiffness, or loss of function. Chronic pain that lasts or recurs for longer than 3 months, often extending for months or even years. Impaired mobility, which is a limitation in the ability to move, which often requires surgery, and bleeding in the brain that may cause long-term problems such as seizure and paralysis. The molecular cause or fundamental reason for hemophilia lay on its proteins. The factor VIII and factor IX gene are proteins vital for blood clotting that activates after injury to help form fibrin clots, or a process called coagulation, as I mentioned before. When this protein is missing or defective, clotting is affected, causing prolonged bleeding. The incidence of this disorder is connected to an X chromosome and is sex-linked, which refers to characteristics or traits that are influenced by genes carried on the sex chromosome. Because females are distinguished by chromosome XX, the males, chromosome XY, are bound to have the disorder. So here in figure 3, we can see this difference. Both of them, male and female, there is 23 pairs of chromosomes, and you see the difference in the 23rd pair. Here you see for male, on the 23rd chromosome, there is the XY, which differentiate from the female on the 23rd chromosome as well, shows that XX. Because hemophilia is located on the X chromosome, then it occurs mainly in males. The hemophilia A is the most common type of the disorder, affects 1 in 4,000 or 1 in 5,000 males worldwide. The hemophilia B is less common and occurs in approximately 1 in 20,000 individuals. Although hemophilia is rare, it can be acquired. So this can happen through autoimmune disease such as lupus, multiple sclerosis, cancer like non-Hodgkin lymphoma, or even certain types of medications such as penicillin or interferon injections, which is deliver man-made versions of proteins. The autoantibodies develop against the coagulation factor, meaning the antibodies mistakenly recognize and attack the body's own tissues or organs. It is commonly known as acquired hemophilia A or AHA. As shown in the previous slide, we have 23 pairs of chromosomes. Inside the chromosomes, we're able to locate the part of the chromosome where the genetic disorder is. For hemophilia, we have the XQ28 and XQ27. The XQ is a specific band on the long arm of the X chromosome. So you can see here on figure 4, we have the short band, which is the upper part, and we have the long band, which is where the hemophilia B and hemophilia A is located. The F8 gene is structurally complex with 26 exons, and the F9 gene is only 8 exons. An exon is a segment of the gene that codes for part of the final molecule, which is later translated into protein. In other words, exons are the coding regions of DNA. Here we have the mode of inheritance, or the pedigree chart. We have a classification here on the right-hand side. So we have the circle with the dot inside, that is for female carriers. We have the black square, which is characteristic for male hemophilia. And we have the circle, the blank circle, which is for an affected female, and the blank square, which is for an affected male. So here we start with first generation. We have the male, which is unaffected, and we have the female carrier. And as you can see, the hemophilia goes through generation, and when we go here all the way to the 5th generation, we see the individuals is still carrying hemophilia. So here at the end on the 5th generation, we do have a total of still 3 males with hemophilia, 2 males that is unaffected, and 1 female carrier. There are genetic testings, and some of them to be considered are the the complete blood count, which is CBC. This test measures the amount of hemoglobin, which is the red pigment inside red blood cells that carries oxygen. The size and numbers of red blood cells and numbers of different types of white blood cells in the blood. It also ensures that the low platelet count is not the cause of unusual bleeding symptoms. We do have the activated partial thromboplastin time, or APTT test. This test measures how long it takes for blood to clot. It will confirm the clotting disorder and guiding factor replacement therapy. Then we have prothrombin time, or PT test. The test also measures the time it takes for blood to clot. The test's primary role in hemophilia diagnosis is to help rule out other bleeding disorders and liver conditions. And the fibrinogen, which helps doctors assess a patient's ability to form a blood clot. It will confirm the hemophilia diagnosis and determine its type and severity. Here I have an example of some labs that can perform those tests. As a reminder, the tests only can be done if requested, usually by a healthcare provider or a licensed physician. Unfortunately, there is no cure for hemophilia yet. However, there are some treatments that can be done. The standard way to treat both hemophilia A and B is to replace the missing blood clotting factor so that the blood can clot properly. People with hemophilia can learn how to perform infusions themselves so that they can stop bleeding episodes, and by performing the infusions on a regular basis, they can also prevent most bleeding episodes. Another treatment is a non-factor product that replaces the function of the missing factor 8. The last one is the gene therapy, which is another option for people with hemophilia A and hemophilia B. The gene therapy is done by injecting copies of the gene that help the body make more clotting factors to prevent bleeding. And here are the references for my research. I hope you enjoyed this presentation, and thank you so much for watching.